So we
Yeah.
are already in the morning. Yeah. So really wonderful. And thanks to Shivani and Rahul for giving this opportunity to connect with you all. And maybe if we can keep our videos on, that would be great. Yeah. So that it can be interactive rather than me just going like a monologue, no? So that would be wonderful. Yes. Good. So, like Shivani said, I started off like she said, I like the word in my previous. So, for me also, I can say like my previous avatar has been to be like, a modern allopathy practitioner. And now I've moved to completely like an integrated approach. I think the next century is going to be only integrated, right? And I think in US already this has started long back. In fact, one of the pioneers in this Dr. David Rackle from US is I should say, my mentor or a guru in the integrative medicine direction, I should say, which is like more of we want evidence based for everything, isn't it? So he is like a pioneer in that. And all my learnings, I should say, is from this specialist Dr. David Rackle. Yes. So with that, I just wanted to connect basically to see that what is our understanding of the health, wellness, well-being. These are like nowadays, it's like become a very common term, isn't it? Hmm? So many of us know wellness, and there are lots of wellness spas cropping up. Wellness tourism is going on. So I just thought, let's understand this a bit. So what I can do now is let me show some small PowerPoint presentation. You made me host, right, Shivani? Thank you.
Yes.
So as you can see, so what's been your takeaway from the pandemic? So after, in our, I think we are, I don't know whether fortunate or unfortunate, I should say, that we have never seen, right, what they called as earlier pandemics of cholera or plague or whatever. So now we were witnessing this corona, and I think it's come back also in some of these places in the world now with different strains. So the one takeaway I would say from corona personally as a practitioner, I found is now a lot of awareness has come that people want to invest in their health, isn't it? I'm using the word invest here because we all know like we have been maybe right from young we have been always catered towards our education, everything is moving towards like making wealth, investing in wealth or protecting the wealth, all of it. But the whole thing dynamics changed in pandemic. In pandemic we learned how much ever you had wealth, how much ever you had money, nothing could stop if something inevitable had to happen, isn't it? So that is why now it's time for us to understand, to invest in health. That is where this term of salutogenesis comes. This, of course, was coined long back. So salutogenesis basically means like salus is health, genesis is origin, origin of the health, and how to create and maintain and preserve was done by a scientist called Anton Antonovsky in late 70s. He has written a book also on that. So he was looking at different populations, and he found out like, okay, we are always focusing on understanding the pathogenesis. Pathogenesis means what? Pathos is disease. So the origin of diseases we are always looking at. Now the shift has to happen where we have to focus on the origin of the health also. That is why he coined this term salutogenesis, where he understood in different populations how people were coping with different stressors to reach the state of salutogenesis, where we normally call it as H minus to H plus. You move in life from H minus, which is health or a disease, where you are having dis-ease. Ease is a state. We are all born with what we say ease state. We are in that equilibrium all the time. But it can get disturbed by various factors which will push you towards this H minus, which is dis-ease. Or you want to move towards health ease, which is H plus. That's the whole journey. So during this journey, we have lots of stressors happening. It can be your physical stressors, mental stressors, so many things. It can be acute episodes or chronic episodes. So it'll keep pushing you going back and back in this line. But how are we going to move towards this H plus? For that, we need to understand these terms. That is why it becomes important that we know what is health, what is wellness, what is well-being. So if you look at that, we all know health has been defined by WHO as what? A complete physical, mental, social well-being, and not merely the absence of a disease or illness. They never said that only the absence of physical diseases, like for example, a viral fever or a bacterial infection or some trauma. No, it included your mental and social well-being also. Only then you can say that person is healthy. So now, okay, how do I reach this state of health? For that, that pathway is your wellness. Wellness is like, I would say, a journey, whereas your health is your goal. When you want to attain all these three states of physical, mental, and social well-being, you need to have a pathway. That pathway is your wellness. That's why you can say health is a state of being, whereas wellness is a state of living a healthy life every single day. Every single day, making those small changes which will take you towards your goal. Like in a football, the passes happen, right? The same way the pass has to happen to reach the goal. So that's why you can see physical, mental, social well-being. This wellness enhances this being. So this is your life goal, and this is a process of reaching the goal. Many people get confused. Health and wellness are not the same, I would say. Health is the goal finally to be reached. Wellness is that small journey that you keep making every single day to reach there. So now I know this. What are these things? Wellness. How can I know what is that wellness which is happening? For that, in fact, beautifully, the National Wellness Institute in US has designed what we call as the 6 pillars. I usually call it as poises. For easy to remember is poises. You maintain your poise, right? So P is for what? Physical wellness. Physical wellness like includes starting from the day time you get up, how your health state of mind is, state of physical health is. Sometimes you get up itself with ouch. So how is that? And then of course your diet through the day, your activity through the day, exercise through the day, and of course your other factors which are obstructing these things in your day-to-day life in the physical realm. So this comes under the physical dimension. So for that, of course, you have to be doing like, one is like self-check you can do. How's my state of mind? How is my physical health today? Or some people resort to doing like every 3 months, every 6 months, they go to do some lab tests or see the doctor. Isn't it? You have these packages, all these health packages you do. Or even to prevent certain illnesses, you start taking immunizations. Like, for example, flu vaccine you take, or you take for hepatitis, you take some vaccines. So these are like, which comes under the physical pillar, the physical dimension of wellness. Then, of course, comes your occupational wellness. Occupational wellness is also equally important, in which you have the physical dimension as well. Like you go to work every day, and every day you come back from work and you feel like, oh my God, I'm so tired, I have neck pain, headache, all these things. That means you need to assess. It could be some physical factor in your workspace which is hindering your progress. It can be as simple as your chair which you're sitting, or just your laptop, or your lighting, or your air condition in the office maybe is having a blast on you. We have recorded several such instances. When we just corrected those factors, then the wellness starts to improve. So the occupational wellness includes your physical. Also, it includes your how you're progressing in your career. Like how good are you learning new skills to keep updated? How is your relationship with your colleagues? All of that comes under your occupational wellness. This is very, very important. And then I say I stands for intellectual wellness. How good are you relaxing yourself by creative? I mean, like you're having stimulating your intellect. See, when you want to have some creative pursuits, your intellect should be sharp, isn't it? So, how good are you? Are you spending time to improve your intellect, for which you are maybe reading books or developing new skills or having some new hobbies? All these are important. If you do not have this, it becomes like a monotony in your life. Or even like playing new games, like mentally stimulating puzzles. or even engaging in some games as such. So all this stimulates your intellectual wellness. Then we talk about social wellness. S stands for social wellness. When we say social wellness is what? How aware are you? Not just about yourself, but also about your surroundings. Are you really taking care of your environment? Many times we have seen, no, the taps will be leaking or the light will be on, street lights will be on. Some people are really geared to, they call up whatever the concerned authorities, they say, oh, the street light is on, can you please switch it off? Or even, the flush is not working, water is leaking somewhere at your workplace, it could be, or somewhere you go there, you find, or something litter on the road. So how aware are you? Or even how aware are you about the community around you? Are you really taking charge of that? It's just not confining yourself to the wellness of your house only, like me, my husband, my children, or my parents, or siblings, or whatever. Are you even taking responsibility for your society around you? Just by smiling, just as you get down from your elevator, you smile at your guard, whatever it can be. So, are you being socially aware? That is also very important. Social wellness, we say. Then, of course, emotional wellness. E stands for emotional wellness. Emotional is what? Like taking charge of your emotions. This is a huge problem currently, isn't it? Youngsters or old, whatever, there is no patience. I need to let out my feelings, whatever be it, whether it is anger, whether it is frustration, whether it is guilt. I need to show my presence. No, that is not where you're progressing towards the goal of health. How much are you taking charge of your emotions and feelings? It's very, very, very important, I would say. Because all this have been proven. And of course, finally, the S is another S is spiritual wellness. Again, how much are you connecting to yourself inside, internally? Every single day, am I sitting for a few minutes to contemplate? Like whether I am looking through my gratitude journal for the day before you go to bed. Just think about all the good things that has happened to you. Yes, there may have been some ups and downs during the day, but still, you came out. You could go to bed. You could sleep. We should be grateful for that. Are we thanking the Almighty for that? This is very, very important. Or whether are you having your self-love? Or are you constantly blaming yourself for everything? Or carrying the guilt, carrying the past guilt or anxiety of the future? So this is very, very another very important dimension of your wellness. As I said once again, these all have been now proven scientifically that a person cannot be considered as a healthy person as long as all these parameters are not taken care of. You can't call a person is healthy. No. We know of some people, they go to gym, their physical body is so good, but still mentally they are like, completely, they show a lot of anger. When they are thrown into some challenge, what happens is the first thing is they'll react, isn't it? Haven't we seen sometimes they want to muscle their way through? Or sometimes we have seen people who are like very meek and subdued. But when challenge arises, maybe they'll be the opposite also. So that is why all the six pillars are important. And now one more dimension has been added to it is what we call as also the financial wellness. We said anyway, wealth is important. But that's why the financial wellness has been kept aside. It's not been brought into the six pillars. So if you want to achieve that state of what we call the poise, the six wellness have to be attended to. Then we know that we are progressing. So how do I know what is it that I should be doing then? Every single day, start making a small, small change in all of these six. You can make a chart for yourself. In the physical wellness, let's say, for example, first thing is you can start looking at, okay, as soon as I get up, how is my state of mind? Am I grumbling? Am I, getting up with tension, stress? Start to say that I am going to gently get up, turning to my right side and see the benefits. You don't have to do to, like tomorrow itself changes will happen. No, you have to start practicing it. That is why you have to practice these small changes. Or maybe the way you brush. Some people, I tell you, the way they brush itself is horrible. And even toothbrush, till it is broken, they keep it with them. So make sure, okay, have I changed that? Have I changed my toothbrush? Look at that. Another very common thing I'll tell you, people don't even want to clean their glasses. They're wearing glasses, they don't want to clean and wear it. Many times it happens, we have to tell them this could be increasing your power of your eyes. Simple thing. Keep some tissue, clean it once in a while. Go check whether there is blurriness, haziness in my glasses. These are small steps, I tell you, it will make a huge change. People take it so light. Then you can look at how I can start to walk. Some people, the way they walk itself is so hurried. So they are always trying to catch a flight or catch a train or whatever. Just observe, take a deep breath, start to walk slowly and see, make your pace even. Then your heart rate will settle down. Same as with eating. Are you mindful in eating? Are you chewing well in eating? Half the time our attention is on television or whatever. So are you chewing well and eating? These things matter. People don't understand actually. See, only when you become dis-ease, you go to the doctor is fixing it temporarily. That is why salutogenesis is what? Healing. It's not giving a temporary curing for you. It's healing your body continuously. It is healing your system. When you start to attend to each and every one of this dimension, I tell you, you will be a completely changed person. This we can guarantee, right? So now coming to what all could be then, as we said, physical and psychological. These two aspects are the main problems which we face in our life, which can impact any of these dimensions of the life. When we talk as a physical, I usually club it as, let's say, toxins which can enter into your system through various routes. Like it can be, I just put some of them here. Like it can be your alcohol, caffeine, fructose, corn syrup, all the which is going to deplete your nutrition from your system. Or you're having time to time infections. There are people who have continuously viral, every month they'll have viral fever or they'll have flu. They go temporarily to the doctor, fix it. Isn't it? We have seen so many. I have seen so many patients come to me like this only. They do not attend to the root of the problem. So it could be a virus, bacteria, parasitic infections. You have been eating out constantly. Maybe you give yourself a rest your gut weekly once, monthly once, whatever. So these are, and of course, social, emotional toxins we discuss now. And heavy metals which are percolated into our soil itself now, water itself. Hmm? Metabolic waste, even the normal things which we have to throw out, like your urine, stool. People, constipation. This, in fact, in my class, I always say, people have this fancy to say, oh, I'm generally a constipated person, doctor. That's not right. You need to pass your stool daily. Oh, once in 2 days only, I usually go, doctor. That's not right. Because these metabolic wastes are kept for a purpose, it has to be removed. Once they accumulate in your system, it starts to give problems, isn't it? So that is why these metabolic wastes are also toxins entering your system. Then, of course, we have some chemicals, pesticides, herbicides, medications. This is a huge one. See, medications, it can be anything, starting from your allopathy to Ayurveda to Siddha, homeopathy, naturopathy, whatever you call. People have this fancy to taking lots of vitamins. They keep on popping multivitamins. In fact, a study says in the US, people die of overvitaminosis, hypervitaminosis. And people tend to take all these herbal concoctions thinking that they are natural. It is also, yes, it is going to affect your physical health as well as your mental health. Then, of course, the allergens, which are, of course, I don't have to say, so much now pervading our pollution, etc., etc. So these are some of, I can say, like a physical toxins which can affect our system, right? I can see some queries or questions. Okay, so people have been asking some questions. We'll take some questions towards the end, no, Shivani?
Yes.
I'm keeping an eye. So if there is a burning question, I will definitely ask. Otherwise, we'll take them at the end.
Okay,
Yeah.
sure, okay. So somebody has asked you, why should I get up from the right side to get up? Okay, that's a very interesting question. Keep that question. I'll answer towards the end. Okay? Yeah, great. Thank you. Then, of course, coming to the psychological part, I don't have to tell you the worst toxin is your stress. Isn't it? We all know. Stress. I need not stress the importance of stress. It's that very important. So what we'll do is now we'll watch a small video. What is the impact of stress on our body?
cramming for a test? Trying to get more done than you have time to do? Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke. When your brain senses stress, it activates your autonomic nervous system. Through this network of nerve connections, your big brain communicates stress to your enteric or intestinal nervous system. Besides causing butterflies in your stomach, this brain-gut connection can disturb the natural rhythmic contractions that move food through your gut, leading to irritable bowel syndrome, and can increase your gut's sensitivity to acid, making you more likely to feel heartburn. Via the gut's nervous system, stress can also change the composition and function of your gut bacteria, which may affect your digestive and overall health. Speaking of digestion, does chronic stress affect your waistline? Well, yes. Cortisol can increase your appetite. It tells your body to replenish your energy stores with energy-dense foods and carbs, causing you to crave comfort foods. High levels of cortisol can also cause you to put on those extra calories as visceral or deep belly fat. This type of fat doesn't just make it harder to button your pants. It is an organ that actively releases hormones and immune system chemicals called cytokines that can increase your risk of developing chronic diseases, such as heart disease and insulin resistance. Meanwhile, stress hormones affect immune cells in a variety of ways. Initially, they help prepare to fight invaders and heal after injury. But chronic stress can dampen the function of some immune cells, make you more susceptible to infections, and slow the rate you heal. Want to live a long life? You may have to curb your chronic stress. That's because it has even been associated with shortened telomeres, the shoelace tip ends of chromosomes that measure a cell's age. Telomeres cap chromosomes to allow DNA to get copied every time a cell divides without damaging the cell's genetic code. And they shorten with each cell division. When telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, chronic stress has even more ways it can sabotage your health, including acne, hair loss, sexual dysfunction, headaches, muscle tension, difficulty concentrating, fatigue, and irritability. So, what does all this mean for you? Your life will always be filled with stressful situations, but what matters to your brain and entire body is how you respond to that stress. If you can view those situations as challenges you can control and master, rather than as threats that are insurmountable, you will perform better in the short run and stay healthy in the long run.
Interesting, isn't it? So, chronic stress, how it can affect our health starting from even aging. We saw that, the genetic part of the gene there. I'm sorry. Sorry. How do you manage oxidative children with chronic conditions? Yeah, we will take all those questions. Okay. We'll continue with our PowerPoint. So moving on, we saw the twice. So way to de-stress. If you look at it, we have different scientifically proven methods to de-stress the body. Like you can see yoga, asanas, breathing techniques, meditation, progressive muscle relaxation, autogenic training, relaxation responses, biofeedback. These are some of the techniques which have been actually scientifically studied for the de-stress. Like emotional freedom techniques. There are the energy psychology is incorporated in these techniques. So for example, somebody has got, let's say, some botheration. Something is like somebody is insulted them and they are affected by it. They want to get rid of it. So you can actually tap 9 points. Out of the 9 points, they say 7 points are very effective in taking care of this, whatever the pain, mental pain or a physical pain also it can be. So they say you can tap between your eyebrows. Then you can tap at the sides of your. Then you can do it below the eyes. Sides of the eyes, below the eyes, you can do below the nostrils, below the lower lip you can do. Then you can do it actually below the collarbone. Below the collarbone you can tap and at below the, under the armpit. So these 7 points have been identified as actual stress reliever, both physical and mental stress. You can do this. Or they also say there are 4 important energy gates in the body through which you can let out your physical and mental stress. In fact, they say you can practice this every day also. I'll show it towards the end. We will discuss it towards the end. There's 4 regions of the body where you can every day. It's a very simple technique. You have to just do it for only 1 minute to 2 minutes. Those 4 areas, if you do, it will help you to release. It's one of the parts of the traditional Chinese medicine. This emotional freedom technique can help you in that. Okay, now we know what is health, what is wellness. I have to make the journey or whatever. So who's that we saw? Who must take this journey? I must take this journey. Isn't it? Now, the whole problem happens is when I am taking this journey. For example, let us say you've gone to the doctor. The doctor has said that now you've got some cholesterol. Your cholesterol is high. You have to take care of your cholesterol problem. He says that you have to be careful in eating your fats. You should avoid saturated fats. You should avoid deep fried items. All these things he's giving you advice. So what happens in your system? So we are existing in some realm. We are existing in some dimensions. And all these dimensions start talking to you simultaneously. So now you know the body has got cholesterol. The mind is saying, oh, I love that pizza, especially with that added cheese on top, with all the toppings, right? So the mind wants to go there. But that intellect is, very sharp, no? It has got the property to say which is good, which is bad. So it is saying, no, doctor has told you cholesterol issue, you can't eat it now. But what this memory does? Oh no, last time I had it from that place, no, it was so good. Very powerful. Or it will say, no, I am so meek, I submit to this, I want to eat my pizza. So this is a realm is going on. One pizza can trigger all these things in your body. Has it not happened to you? Anytime, any action you take, whether it is not just related to food, then finally this inner self has to really bring the control of all these things and say, okay, just keep quiet. Now you can't eat. Your cholesterol is high, so just listen to me now. But to reach this self-control, you have to control all these fellows. Isn't it? That is your obstacle in your path of wellness and health. Right? The obstacles are what? All these obstacles playing through all these layers. That is why, the Patanjali, I would say, in fact, again, he is again my mentor, and whatever I look up to is Patanjali is one of the best scientists, doctor, philosopher. I can give whatever name for him. He is such a wonderful in those, how many ever Vedic era he wrote about some couplets, right? Out of which maybe he wrote some 133 or whatever. In that, he wrote only two pertaining to actual, two or three only pertaining to asanas. The remaining all he studied the mind in depth, which is actually stopping you from going towards your goal of wellness. Yoga means what? Yoga is nothing but I equate to wellness. Yoga is a path, and yoga is also an obstacle for many people. What are those obstacles where you can't reach your health as a goal? See, these are the things we saw. Right? So these are the obstacles he is talking about in pursuing your goal. One is vyadi, physical illness coming now and then every month, as I said. Or it can be illness in the mind or doubting. Suppose you have taken up some technique. You decided, okay, I am going to start this exercise. Somebody has recommended this for me. I'm going to start. You start for 2-3 days, then nothing is happening to you. Then you start to doubt that also. Then comes your not giving priority. Pramada means actually what? Not giving priorities to that. Making it the least priority in your life. Laziness. This we all know. All of us have this obstacle. Right? Then overindulgence in senses. Constantly you're engaging in your five senses. See, when you're not going to give rest to your mouth, constantly if you're eating, enjoying all the sensual pleasures, it is also going to be a impediment for you. Or like hallucinating, thinking that, oh, I can overachieve, but not doing any action, just only hallucinating on things. And of course, non-attainment means what? That you are not able to achieve. Okay, some people, in spite of all these things, they have been progressing, doing something. But non-attainment is because not having a focus. And okay, some people have finally reached also there, but they lost it there. Some people you have seen, 1 year they'll be doing all activities, everything. They are so busy. They go to the gym, they go to running, they do everything. Then they give up. So actually only these 9 are there. There is no 10th one at all. These are your 9 obstacles, the impediments to your in the path of wellness or health or whatever you can call yoga. Right? So how can I then overcome this? To overcome this, you need only these 3 things. Dispassion, dedication, discipline. These 3 things only can take you over from the 9 obstacles. But now again the question comes, okay, you are saying all these things, but again, this is also mind level. At mind level, I should have discipline. Mind level, I should be dedicated. So can I control my mind from my mind level? Is it possible? No. If you ask your mind to say, okay, it will say, mind, you shut up. It will never shut up. It wants to only do if you ask a monkey, we say, no, not to dance, it will only dance. Same way, your mind also will do the same thing. So that is where we have another fantastic realm of your existence, which is going to help you to move in that. That is what moving from body, the gross, to all these levels. If you want to control, there is something in between. That is your breath. The more you take attention of your breath every single day, you start to take care of your breath. It's just simple attention to your breath. I tell you, you can change your whole, all these realms, and then you can start seeing changes happening. Where you move on to discipline, dedication, dispassion, all these things will come into you and nobody can shake you, whether it is your physical or mental problem. All the stressors can keep coming back in your life as you are progressing in that path. But I tell you, once you have paid attention to this breath alone, all these things will automatically fall in place. That is why we keep saying, even if you looked at the ways to de-stress, what was the first one it said in the slide? Yoga, asanas, breathing. They are very powerful. Now more and more studies are there to say that when you want to progress in the dimension of wellness towards the health, yogic practices 100% help you to move there. And so for that, first level is what you have to attend to the body level, isn't it? First is what? Body level you have to attend to. That is your physical. In the poiesis itself, if you look at it, body comes under the physical dimension. For this, you have to do, as we said, some yoga stretches you can do, asanas, and then you can do some exercise like walking, or some people like to do some, little bit more physically strenuous activities. You can do that, swimming, cycling, trekking, whatever. So take care of the body through that. Breath, of course, breathing exercise, pranayams. Various types of pranayams are there to help nowadays. Simple things that do. And of course, mind. When you want to talk about, the occupational wellness we talked about, it involves both the body as well as the mind, isn't it? And also intellect to a certain extent, because in your office space, if you want to be alert, aware, your intellectual wellness is important. And of course, with your past experiences, memory comes to play a role. With your past experience, how it has been with your boss, all this, if you want to attend to, you need all these layers. If you want to attend to the 6 pillars of your wellness, you need all these layers of your existence. And how you can take care of these layers of your existence with simple things. One is doing some stretches, doing some breathing exercises. You can automatically cleanse all these layers. Then you are established in yourself. That means what? Your self-control has happened. Your dispassion, discipline, dedication has happened. These are all properties of self, let's say. Then nothing will shake all these things. Now you'll start to become more aware and aware that which level of my existence I am talking from. Oh, now my mind is taken over. Now I know how to take care of it. Or my intellect is saying this. Intellect becomes sharp means what? Your intuition becomes sharp. Then whatever decision you take, you will never regret. Or you'll never go into guilt mode. Isn't it? So all these layers will get sharpened once you little bit attend to your breath. That's all you have to do. It's as simple as that. This is just one method I'm talking about. Of course, we saw all the other methods, isn't it? We saw like guided imagery, emotional freedom techniques. We saw energy healing techniques are there. There are several such techniques. But simplest, I would say, is just attending to the body by doing simple stretches and some breathing exercise. That is good enough for you, isn't it? So now what we'll do is we will experience how we can take care of this by simple techniques. As I said, the 4 energy gates, if you take care of it, you can easily take care of your day to day. So the first one they say is, you can take your hand, you hold your hand, you're holding your hand like this, and then you take this like I am right hand dominant person. So this right hand has to press on this portion between the left thumb and this, they pan out, right? Here you press. You keep it, 1 second. Okay, so are you able to see? This is how I'm keeping. Then you just have to press this point in a circular motion for 2 minutes. This is a very effective technique. If you're a left dominant person, you can do the other way around also. That's also fine. Yeah. So that is the first technique that you can do. The second is you can place your palms across like this between your chest, breast. And they say you do circular motion 200 times. Circular clockwise, then anti-clockwise 200 times. So that is the second point you can do. This, they say, if you practice regularly, then and there, whatever you have like issues, it will all get resolved, whether it's physical or mental stress which is bothering you. The third point is at your belly button. So take 4 fingers and place it below your belly button. 4 fingers below your belly button. And what you do, take the other hand, make a light fist. And On the sides where the four finger breadth below the belly button is there, on both the sides, you have to tap for 2 minutes. Left side, then you can make fist to the right and then do it on the right side. So this is the third point you can do. The fourth point is they say you can stand up exactly at the midpoint of your buttocks. You make like a light fist and keep tapping 200 times. Exactly at the midpoint of your buttocks. So you make a fist and you tap. So these are called as a four energy, main energy where they run, the nadis which run. Okay. So that will help you to release all the then and there the toxins or whatever the mental toxins, physical toxins, whatever, it will help you to release that. So every day morning you get up, you can do this very simple exercise. So first, as I said, on this, you rotate. Then second is cross, place between, and you can do. And third is, remember, four finger breadths below the belly button. On either side, you tap. And then you tap at the midpoint of your buttocks 200 times. Yeah. And of course, we saw the emotional freedom techniques also, where you can tap between the eyebrows, the sides of the, and then you do below the eyes, then below the nose, below the lower lips, then below the clavicle, collarbone, you can tap, and then tap below the armpit, or like lateral side, you can say. That we can do. These are like some simple techniques that we can do. All right. Good. And also when we talk about, like, see, so many of us may have done your yoga and pranayam, all this, maybe you're aware, right? So what is important is consistency in practice, which we talked about as, discipline. For that only the small changes have to happen. How that small changes will happen? Because this brain, no, it's already like wired with certain habits of ours. They say it takes about at least 66 days, it seems, if you want to start off with something new. So 66 days you have to keep on practicing the same thing. Like when we were young, our parents taught us to brush the teeth. You kept on doing brushing. Now it is ingrained. So naturally you get up straight, you go to the washroom to brush your teeth, right? So if you want to, for example, you have been doing right side brushing, right hand, you're dominant, you're doing right side brushing, right? Now you want to start doing with your left hand. That means what? This neuron has already formed a circuit in your brain saying that this is how I'm going to work. This is how my toothbrush is going. When you want to change the direction, you have to do it 66 days to change to left hand. That is why it's not very easy. Whenever you start making changes, any new changes you bring in your life, it is a little challenging, but it's not difficult also. That's why we say start with small changes. Never go for big, saying that, okay, from tomorrow I'm going to get up at 4 o'clock in the morning, 3:30, I'll do Brahma Muhurta, I will start meditating, I will do this. No, don't do all those things. Just, first thing is what you observe. What time am I going to bed, first of all? In fact, in my class, I repeatedly say, put alarm to go to sleep. Never put alarm to get up. Put alarm and go to sleep. Then I tell you, your body clock will automatically wake you up. That at 4:30 or 5, whatever your mind, subconscious mind wants you to get up. This you try, I'm telling you. Because the problem nowadays is like we are having varied times to go to sleep. One day I'm 9:30, one day 10:30, one day 12:30, one day 1 o'clock also, one day even 4 o'clock in the morning. So that is a problem. Our entire internal cues are lost, isn't it? The entire internal rhythm is lost. That's a problem. That is why I say put alarm and go to sleep daily for next 1 week only. Just practice this. Then you'll start to see so much changes happening in you. Make small changes. Don't jump to make like anything big at all. Because I tell you, when you start to make big things, you will definitely fail only. Unless you're really trained, you have been in the army or, whatever, you're so much disciplined, yes, you can do it. But otherwise, we are all normal mortal beings. All of us have issues, right? And I know it. Many patients, yes, this is a challenge. So just why I tell them, start making small changes towards it. Every day is like a wellness goal for you. Put a big chart in your refrigerator or your room, wherever you want to write down these 6 wellness, what are they? And make yourself what you want to make that change. It can be as simple as like, I'm going to smile more. for no reason. It's okay. Maybe a few days people may think, oh, what has gone wrong with this fellow? He's so crazy. It's okay. Once in a while, let's be crazy also. There's nothing wrong in it, right? So smile more. Make it a habit. I tell you, once you do that, so many things will start relaxing inside you. Then you're already going slowly towards it. Like the hare and tortoise race. Let's all be like, tortoise, no hurry, but we'll reach the goal finally anyway. That way, yes, it is possible. Many people, you take any of these people who are very successful, so-called success, which with their own definitions, they all built it gradually. Isn't it? Whether it is your wealth or whatever, you have to build it gradually. And it is possible. Never give up. Okay, you feel like today, okay, I didn't do it. It's okay. Don't be harsh on yourself. Don't punish yourself saying that, oh no, I'm so bad. I didn't do this. No, it's okay. Oh, so what? Tomorrow will be my next one, number one. I'll start again. I'll start again. This way you will never ever fail. As I said, it can be small goals, but you will be able to reach. Right? What do you say? Isn't it? It's as simple as that. Now, maybe some questions we will take. Okay. So why should we lie on the right side, right? Somebody was asking this question. See what happens in the body. There are around, we say 72,000 nadis or channels, or even more also. Out of which there are three important nadis, we say. We call them as right side nadi, left side nadi, or central nadi. You all may have known also. Sushumna nadi is called the central nadi. Then we say the right side nadi, which ends on your right nostril. Then the left side nostril, Pingala nadi. I mean, Ida nadi and Pingala nadi, we say. So what do they correspond to? See, what happens is our body in the autonomic nervous system, we say, isn't it? We saw in the video also. Autonomic nervous system is where your sympathetic, parasympathetic drives are happening. Which means what? Your sympathetic is what? Adrenaline release. See, for example, you are walking in the forest, you have encountered a tiger. Three things only can happen. First is what? Looking at the tiger, you will get scared, right? So that's fright. Then second is what? You want to run. So that's flight. Or you don't have any option, what you'll do? You'll start fighting the tiger. So that is fight. So the fright, flight, fight. These three modes come through your sympathetic drive, which is through adrenaline, we say, which is needed for the body. This is a coping mechanism in the body. But the problem nowadays is people are constantly in the sympathetic overdrive. Constantly. Everything is like they're encountering a tiger in their life. That is why what is happening is all the illnesses, the dis-ease, we talked about now H minus, going towards the H minus, the dis-ease state is because of the sympathetic overdrive. So our aim is move the opposite, which is your parasympathetic, which is your relax and digest. All your digestive process, relaxation process can happen only if your parasympathetic drive is good. The vagal tone, we say. So how does that happen? That is always through your breathing exercise. Breath plays a very important role in your parasympathetic drive. That is why we say, whenever you're stressed also, what do we say? Take a deep breath and relax. That means what? It's automatically shifting from sympathetic to this. So now coming back to this, if you look at the Ida Nadi corresponds to the lunar side, the right side of the brain, which is for all your creative activity, like artistic pursuits in life, music, dance, or even painting. Which corresponds to the intellect, intellectual capabilities, all your metabolic activities, because the sun is fire element. All your metabolism of like your hunger, appetite, thirst, sexual activity, all this, if it has to run smoothly, your right should be active, which is sympathetic. This is parasympathetic. You can only put your finger and see which is dominant now. Suppose, see, if your right is dominant, that's the time you should go and eat. Then your food will digest well. When your left is dominant, go and sleep, rest. Other way around we do. When the left is dominant, we go and eat, then your food will never digest properly. That's why we say, take your food when the right is dominant and left you go and rest. Because this is feminine energy, this is lunar, solar energy, which is sun energy, right? So when you turn to the right side and you get up, what happens? Which nadi is on the dominant side? The left, isn't it? When you turn to the right side and sleep, then your left becomes dominant. That means you're parasympathetic. So you get up with a cool state of mind. You don't want to get up with a sympathetic overdrive in the morning itself. If you want to have a cool, always turn to your right side and get up. Give yourself few seconds, sit up in the bed. Again, like you go to bed with a gratitude, get up also with a gratitude that you got up first of all today with all your limbs intact. Just pray. Give yourself that 1 second to pray. Then you start your day. Otherwise, you're all always rushing. Get up from the bed, jump out of the bed. Who said jump out of the bed? First of all, that itself is wrong. Get out of your bed in a normal, relaxed manner. Okay. So that is why we say get up from the right side to keep the left nadi on the top. Okay. Then what was the question? How do you manage oxidative stress in children with chronic conditions? It's a little difficult, and also we need to know what is that specific condition. Say oxidative stress happens, it's a general term. Oxidative stress is what it leads to inflammation. There are thousands of inflammatory conditions in the body. So we need to understand which is that particular condition, and accordingly we can tell them what is best for them. Should we think or say something while tapping? Yeah. In fact, in the emotional freedom technique, they say that even though I have this problem, now I'm free of it. You can say while you're tapping those points. Even though I am having this, I am like, I love myself more. I am more compassionate towards myself. So you can say that and tap also. Is this tapping method okay for kids? Yes. Very good for kids also. What is a good way to start waking up early to get more time during the day? As I said, first start by putting alarm for the night. Then automatically you'll get up in the morning. Make small changes. As I told you, don't see, for example, you are a person who gets up, let's say at 7:30 in the morning. So from tomorrow, what you do is say to yourself that I am going to get up at first of all 7:30 itself. Because some days you say 7:30 means you may get up at 8 o'clock also. Instead, 7:30 I'm going to get up. Then you can say, okay, maybe I'll get up at next week, you say 7 o'clock. Then next week 6:30. Like that you progress. As I told you, don't straight away say from tomorrow 3:30 means never you will get up. That itself will become a burden for you, right? So make small changes. And also we say whenever you want to make some changes like this, you can do it out of two things only in life. One is what? One is out of fear. Because, oh, if I don't do these activities, maybe I'm having already this problem, it will get worsened. So out of fear, you can do that. Or maybe you can think like if some people do this also, they'll attach it to something. Like say, okay, if I get up daily like this, maybe I'll get 1 lakh in my lottery. I'll get up like this. Some people, they do that also. It works for them. They'll say, oh, maybe I'll get a lottery of, whatever, or maybe whatever they like. Then it'll work for them. Or of course, definitely love out of something. Oh, maybe you can say, I love my child so much. Maybe if I don't get up on time, something will happen to him or her. So I will get up then. So like that, you attach either out of love or out of fear, any of these activities you can change for yourself, right? And make small changes. Nowadays, there is so much information, what's healthy and what's good for you to eat and not to eat, how to filter all that information, how to decide what's best for us. Yeah, I know. So you come to a detox workshop, we will teach you more. Yeah. So in our detox workshop, actually, this very interesting detox simplified workshop, which I run usually, is like it was designed during the Corona times. So my aim was to make people understand first their body. You should know, no, or how is your liver working, how is your kidney working, lung, not in a very detailed manner. You don't have to become a MBBS doctor to understand that, but little bit of understanding always will go a long way to know that, oh, if I am doing this, this is what is happening inside. Then you will be able to correct yourself. That is why we say in anything, first step is awareness, right? This is what we are doing in that workshop, bringing about the awareness of your organs so that what are all the toxins which are actually affecting it and how, in which way does it manifest and how I can tackle them through simple techniques. That's why it's called simplified. Because, in olden times, there are methods written in Vedic times, it is written in yogic texts, how they actually used to detox their body. These are like very normal people, we can't even do. Maybe Baba Ramdev maybe can do all that. But for us, we need something very simple in modern times, right? So that is why we called it simplified. By using principles of various holistic medicine, like your Ayurvedic principles or the principles of traditional Chinese medicine, energy healing medicines, instrumental music. Some instruments, when you play, they can heal your organ inside. This was discovered by Greek scientist Pythagoras many centuries ago. When he was playing a particular instrument, he found that it matched to the frequency of the organ inside, and he could heal the organ. So we are trying to actually bring about awareness of all these things, whereby your body can naturally heal itself instead of resorting to all the so-called medications. See, modern medicine, I'm not against modern medicine. Yes, technology is needed. Has we advanced in technology? Have we advanced in our health? No, isn't it? In fact, you know what? The whole business is running around something called healthcare these days. I would say that itself is wrong terminology. Healthcare means what? You're only trying to take care of all that is like your hospital and the associated administration and the instruments there. You're taking care of that. Actually, doctors should be what? Patient care oriented. They should not be healthcare oriented. The whole problem of corporatization has happened and it led to what we call healthcare, whereby doctors are making money to sustain the hospital and the instruments and etc. etc. So that is why I would say patient care is important, means what? Doctors are healers first. The word doctor itself is what? Doctoring the whole thing. Isn't it? In English, we say, no, doctored. We are healers first. We have to heal the body and mind. That is what is a duty. That means what? You tap the inner potential of the person so that he can heal by himself. And it's very much possible. Yes, we have to take the use of technology or whatever modern science is advancing, we can use them. But what is needed ultimately is what? If it was so, then not so much of diseases will be prevalent, isn't it? Look at the lifestyle diseases which are now present. And they've named it itself as lifestyle medicine only now. Because they know in lifestyle medicine, you can't give a single pill and cure it. Is there any single pill which can cure any of these lifestyle diseases? No, no. See, if there is bacterial infection, you take something for typhoid or for something else you take, and then you can get cured of that. But not so for the lifestyle diseases. For lifestyle medicine, you need a holistic approach. That is what everything is now going towards that. Right? More and more scientific evidence is also pointing towards that. Right? So all these techniques and everything is helping you to tap that inner potential. How to reduce HbA1c? Exercise, food, and medications are practiced daily. We'll do one-on-one. Then we will come to know. And what is tapping? Tapping is itself a technique where you can use, like with your fist, you can use your fist to tap the point specifically in your body, or they say you can use even a hairbrush. Your hairbrush can also be used to tap different points in your body to activate them. Will detox workshop be recorded? Detox workshop is recorded, but recording is not shared. So you can join at your own convenient timing. Do you believe in vaccination and immunizations? See, I am in the modern medicine practitioner, so I can't say that I don't totally believe in it also. Yes, I myself have vaccinated my child as well as I myself got vaccinated for corona. So it is still little debatable. Still, we don't have conclusive evidence whether it is like helpful or not helpful. Till such time, yes, I would say that I am following vaccinations and immunizations. Whether I'm doing it with 100% belief or faith, I don't know. But yes, as I said, my what do you call modern medicine advocates it. So yes, right. Any other questions? Anything? All right. Yes, Shivani. Any more
Yeah.
questions? Anybody would like to unmute and ask also? Maybe they can, right?
Yeah, sure.
How do I reach for one-on-one consultation? Yeah, I can share the link also. I'll share the link as well. Yeah. Yes.
Yeah. Hi, doctor. This is Shaila.
Yes.
I attended your detox mind and body, I think
Yes.
2 weeks ago.
Yes, Shaila, I remember.
Yeah. So, I was recently diagnosed with osteoarthritis.
Right.
I just want to see what type of asanas I should be doing, what asanas I should be avoiding.
Right.
So I would like to consult with you. So it's a link or your phone number. How do I?
We had shared it in the groups also. There is a Calendly app link. You can connect through that where we have a Google Meet. I can connect you through the Google Meet. Yeah.
Okay, you're going to share it here now, or?
Maybe I'll share it with Shivani. Maybe she can share it with
Sure.
you. Yeah.
Okay, all right. Yeah,
Yes.
thank you.
Yeah. Yes. Yeah. But osteoarthritis, don't worry. As I told you, it is one of those degenerative conditions of the knee joint. And predominantly it is seen in women. And it is like as we age, it can happen. And they say it is due to stress. Mental stress actually aggravates osteoarthritis. Hmm? Because there are several types of arthritis. Osteoarthritis is a degenerative process which happens in the knee joint because of stress. One study says like even turmeric can help. Taking turmeric supplements can help. And of course, yes, de-stress is the first important thing for osteoarthritis. The ones, especially if you de-stress yourself, the arthritis can go away.
Should I get tested for bone density?
I don't think so. Osteoarthritis has got nothing to do with your bone density. Bone density is for osteoporosis. For osteoarthritis, it is in the knee joint where there is a degeneration happening in the joint which has got some cartilage and ligaments, other structures can get destroyed because of which you can get the osteoarthritis. Yeah.
But I have aches in my limbs, both my hands, and if
Yeah.
I do my dishes, if I stand in the in front of the sink for 10 minutes, my back
Right.
starts hurting and kind of burning sensation.
You can do your density. That is anyway, besides this one, you can do your bone density test. That's no problem. But for osteoarthritis, specifically for especially the knee joint, if you're mentioning, then
Yeah.
yes, it is more stress related. And other thing is also check your Nadi Pariksha. Do your Nadi Pariksha, get your assessment of what is your Prakriti or the body constitution type. We discussed in
Okay.
the class, right? What is your Vata or a Pitta or a Kapha?
Yeah.
Then maybe, Vata element is high, then you tend to get always all these types of aches and pains and arthritis and all. So once you, take care of the Vata element, then you can take care of
Yeah,
it.
mine is actually Vata and Pitta. So yeah.
Yeah, so take care of the Vata. Maybe you can add more ghee in your diet. Put 2, 3 drops of castor oil in your belly button daily before you go to sleep. And you can put castor oil in your, top of the head crown and also the feet, your soles of the feet. You can apply castor oil and sleep. That will help to take away the Vata from your system. Yeah.
Thank you. Yeah. Yeah. Thank you for sharing, Shivani. I got the link. Thanks.
Yeah.
Can I ask the question?
Yes, please.
I have fibromyalgia. That's what I was diagnosed. And
Okay.
I'm achy all the time. Every day I'm sick in the morning. My body
Right.
aches. I don't want to get up. And then I get into depression. And it is very, very difficult. By the time 11 o'clock, I start my day. That's what happens. Somehow or other, I get up here. Every day I have to fight with it. So,
Okay.
and I try to do yoga, but I get up late and I know how to do yoga. Pranayama knows, tapping you showed some of them I know, but I don't do it regularly because of my health. So,
Okay.
what is I can do for morning especially?
Right. Shobna ji, for you, I think fibromyalgia, the proven remedy is besides all these things, yoga, etc., you should go for what we call a CBT, we say. Cognitive behavioral therapy has shown to improve fibromyalgia a lot. Besides medications for some people, besides whatever you call yoga, etc. So look for somebody in your place where you can find a behavioral therapist. You can go for that because cognitive behavioral therapy can help for fibromyalgia. I know it is very difficult condition. And so once a lot of improvement has happened after CBT, they say. So you can try along with this, that also should be done.
That will be difficult to find. I don't know.
I have one, Shobana ji, I have one here close by. I will share the contact with you.
Sure.
Yes.
Thank you.
Thank you. Yes. Okay. So anything else more? You have any questions? Otherwise,
I have a quick
it is very
question.
nice. Yes, yes,
I have a
yes.
quick question, Dr. Dalita ji. My
Yes.
mom is in Hyderabad and she was diagnosed with non-Hodgkin's lymphoma like a year ago, and she received 6 months of chemotherapy.
Okay.
But the chemotherapy was very hard on her, so we had to like stop it before we could complete the entire, 8 sessions or whatever that they recommended. But the
Okay.
major problem is she has been having a recurring UTI like for almost a year now, and she's having a very tough time. So do
Okay.
you think you can help her? Is that something
We have
that can be
to
helped?
see because it is, we need to understand the patient one on one. So lots of questions I need to ask her. Maybe if you can connect her to me, then yes, I can, see how we can help her moving forward. Yeah.
Okay, okay. All right.
Yeah.
All
Yes.
right. Thank
Okay.
you.
I have
Thank you.
I have a question.
Yes,
When is
Rinkuji.
the last date to register for the workshop? March is a bit far away. I mean, for me at least. And
Okay.
is it possible to register like towards the end or mid-Feb, when the schedule becomes clearer? Is there a
Sure.
last date? Or are is there
Yeah.
limited attendance?
You can register to mid-February also or end Feb also is fine. We keep it open till the end also. Till Feb 28th, we are planning to keep it open. So don't worry. Yes.
Okay, and will somebody send a message on the group saying that registration is closing or something? That would be helpful.
Yeah. Sure.
Thank you.
Shivani ji is already doing a great job. So I'm
Thank you,
sure,
thank
yes,
you,
they
Shivani
will.
ji.
Yeah. Yes. Yeah. Right. Yes. Anybody else? Anything?
So I would say just take this time out. It's very little time, you can take out this time for yourself and attend the workshop. It has been just an amazing experience for me and my husband both. And just, don't doubt yourself and just come for the workshop.
And I think
Yeah.
what I'll add is it's not only the workshop, but the follow-ups. There are like, I can't believe it. There are like 5 follow-ups every day. So there's no excuse you can't attend any of them. So I think that's been our lifeline. You finish work and you join one of the follow-ups, and 40 minutes you get what you want, your liver or kidney one day or heart one day, and it's been a lifesaver. So, and I have been going through some serious chronic conditions over the past 2-3 years. I can say I left my diabetes medication, I left my high blood pressure medication, and just my numbers came in, and knock on wood, they are good. So thank you, Lalita ji.
Yeah.
So
It's
this,
it's really absolutely marvelous. I should really, applaud Shivani and Rahul for being that three things: dedication, determination, and discipline. Yes. See, I know it's the first thing only is a little challenge. After that, it's been amazing journey. They have been with me like last now 3 years, right? Since 2021, we are together, and it is absolutely phenomenal. Like, I like to see like this, a personal growth in them. Because my actually aim is like I want people to move away from medications, especially the allopathy medications. Only when it is really required, you should be taking. Otherwise, as I said too, I really want people to understand their healing potential of their body. To bring about that, I tell you, it can do wonders to you, right? That's the ultimate message I would like to give. Yes. Yes, Rinkuji, you want to say something?
one more question. I'm sorry, I joined late, unfortunately. So
No problem.
from March 1st to 5th, it's like 2-hour sessions every day. And then
That's right.
in addition to that, there are follow-ups every day.
That's right. That's right. Yeah. Yeah.
The follow-ups
Yes.
are with one-to-one follow-ups or just an open
It's a
session?
group follow-ups. It's a group follow-ups where we have timings, different timings we have. Like morning, Indian timing 6:30, we have one. Then we have at 7:30. Then we have 8:30. Then we have in the evening Indian time 5:30 and 6:30 also, which runs for about 35 to 40 minutes.
Got it. Thank you.
Yeah. Plus, we are also planning to have like region-specific timings to be introduced. A little bit more also will be introduced in the future. Yeah. Yes. Okay. Thank you so much. Yes. Thank you all for your support. And yes, wonderful. Is
Thank
it
you so
possible to
much.
get rid of thyroid medicines which someone has been? Yeah. Yes, Imaji, you can remove your thyroid medicines also. Okay. Thank you. Thank you so much. And see you all. Yes. Thanks, Shivani and Rahul. Thank you so much.
Thank you,
Yes.
doctor. Have a wonderful day.
Thank you.
Thank you.
You all
Thank you.
too. Yes. Good
Bye-bye.
night to you all.
Yeah.
Yes.
Good night.
Bye.
Bye.
Yeah. Bye. Bye.